talk sex. Don't get excited, ladies. It's painful sex. This is something that I've heard frequently discussed amongst my peers. That at a certain time in our lives, and maybe even younger, I mean, Brooke's going to get into that with us, that sex can hurt, but there's a reason for it. That's a pelvic floor issue. And if you missed our last episode where we discussed what pelvic floor issues are, I'll encourage you to go watch it. I'll post a link. But today, we have invited back physical therapist Brooke Greene, who specializes in pelvic floor issues for women and, yes, men. This is just one of 3 episodes where we're going to address a pelvic floor issue that many of us are experiencing. I'm Jodi Silverman, certified life coach, founder of the Moms Who Dare community, and your host of In the Nest. And it's time to get real and open up on these issues. Hey, Brooke, it's so good to have you back in the nest again. How are you?
Hi, Jodi. Good. Thanks for having me.
You're welcome. You're welcome. So can you briefly remind the audience, in case some of them missed our first episode, and just tell them briefly who you are and what it is that you do? And then I want to get into this topic because I didn't know this was a thing.
That's a good thing. So yes, I'm a pelvic floor physical therapist, but a generalist by nature. I can evaluate the whole body and do examine my patients head to toe, but I also dive in a little bit deeper and look at those pelvic floor muscles themselves to figure out if they're contributing to, in this case, painful sex or any other symptoms you might be having.
All right, good. But okay, so let's talk sex. Let's talk painful sex, because I actually have a really close friend who shared with me that she has experienced this issue. And, you know, I guess fortunately I have not yet, but it's a real serious issue because I can't, it's the one thing you don't want to be painful. It's a beautiful thing between 2 people. So, why does it happen? And is it strictly an age thing, a menopause thing?
Yeah, so it's always a case-by-case basis, and I always have to go on to say, see your healthcare provider first. Make sure there's no other serious cause of your pain with intercourse. But some people complain that intercourse has always been painful, and they thought that's just the way it was. It can happen at any age, but sometimes women complain about it more around menopause, perimenopause, afterwards, just because as we age, our estrogen levels are declining, and those pelvic floor muscles love estrogen. And there's so many other factors that come into play, but libido tends to go down as we age. Maybe our partner, things aren't working right for them anymore, so the frequency declines, and we can experience vaginal atrophy and any number of factors that could contribute to painful intercourse. But just a little refresher too, I have my little pelvic model, and these are your pelvic floor muscles. So they are all around the opening of the vagina. So, in order to have intercourse, those muscles need to be able to relax and not be painful. And we shouldn't have to work through the hurt and grin and bear it.
No. So all right. So if you are experiencing pain, it's important that it's not normal. You should not be having pain constantly while having intercourse. So who do we contact first? Or do you call your OB? I guess I would call my OBGYN first. Is that the first course of action for most people?
Yeah, I would say you want to start there, because if there's any special gynecological testing that they want to do, they're the ones that would do it versus your primary care. And then if you're having any topical, in my little model, the skin isn't pictured, but sometimes there's different skin conditions that can contribute to your pain. So they can rule all of those things out and make sure if you do need some type of ointment or topical cream, they can address it on that level, which then will make you more successful when you come in to see me if there's a muscle component on top of that.
Got it. So that would be a really good first step, is contact your OB/GYN and have an exam. And then what are some things that can be done?
Yeah, so one of the things
if it's really something that we need to come see you with, what can be done to help alleviate this discomfort?
Yeah, so we'll do the exam on you. We'll do a pelvic exam, no speculum or stirrups, but we'll see if those muscles are a part of a culprit. And if they are, and you're comfortable with it, then ideally I do an internal technique and kind of think of like stretching those muscles on very gently. Our goal is to never, have your pain through the roof, because then if you're if you're tensing and guarding, you'll never be able to relax, and that vicious cycle will continue. So,
I'm going
and
like
then
this, like I'm feeling them, like going like this, like as you're talking, I'm like, ooh, okay.
yeah, pain, that's what we do. So that's never my goal. But we'll look at your hips. Sometimes tightness in the hips carries into the pelvic floor. We're still looking at all those other factors. But then I also take the time to ask women, what are you using for a lubricant? That's one of my first questions, because if you go into CVS or, any drugstore, you're basically going to find Astroglide, KY, and a store brand, right? So not to bash, and maybe I shouldn't name names, but generally speaking, they aren't made with the cleanest ingredients. They're not the best for your pH in your body. You want to look for things that are glycerin-free, paraben-free, and God only knows there's so many different types of lubricants out there. There's water-based, there's oil-based. We could get into all of that stuff too, but that's a separate conversation that I have with the patient, and we can help them determine what is the best choice for them. But generally speaking, we want to get you some good, clean ingredients that aren't going to promote those tissues drying out more, becoming more and more irritated.
So that's good. And you did mention that with menopause, with the decrease in estrogen, that contributes to more drying and vaginal atrophy and narrowing and all of that, right? Yes. So, God, we have so much to look forward to. I don't know. Oprah Winfrey has told us that the 40s and 50s are so super empowering. This menopause thing does not feel very empowering. It feels disempowering, but we're going to take it back because we have people like you that we can come visit. So, yeah. So, but I want to talk before we wrap this whole thing up. You said something to me when we first spoke, and I thought, okay, this is an interesting way to phrase it. Do you remember what you said? Do you want to tell them what you told me?
Oh yeah, my classic line. Women are slow cookers and men are microwaves.
And I said, what did you mean by women are slow cookers and men are microwaves? Although I thought I assumed I knew, and I didn't want to make it sound. What do you mean when you say that?
So as women, basically, we aren't a flip of the switch. When men are aroused, things work ideally, but in our case, it takes time. It takes a warm up, foreplay, whatever word you want to call it, because when we are aroused, and that doesn't happen in the flick of a light switch, it's literally, whatever someone needs. They need to communicate with their partner, but that arousal allows for the muscles around the pelvic floor to relax. The vagina actually expands, elongates, things we didn't even know what happens, improves the blood flow to the area and relaxation. Because if you're not in the mood and you already have a history of pain with intercourse, that is not going to help anything. So it's really essential to talk to your partner about what works for you and ensure there's adequate time for you to get in the
mood. It's really important to communicate effectively with your partner. If you are not wanting to have sex because of any reason, because your libido is down or because you're having pain or dryness, and it's important to share that with them. As embarrassing as you might feel it is, and I am an extremely modest person. Talking about this stuff does not come easy for me, but it's better to be a little uncomfortable with your partner in life and let him or her know that, listen, this is what's happening. This isn't about me not loving you. This isn't about me not finding you attractive. This, assuming that's not, if this is what's happening to me, and this happens to, if it's me talking, it's like, look, I'm in menopause and this happens. I found out from my doctor, this happens. This is not about us as a couple, but I want you to know that I love you. But you have to have that dialogue, because men don't know what happens to us. If we don't know all that happens to us and our body, how could our partners always know, right? And vice versa. So as uncomfortable and as embarrassed as some of us might be, because if you're like me, I'm extremely modest in talking about sex stuff. It's just, you'll feel so relieved once you do, because the last thing you want is for either one of you to assume the other one is not attractive. And then that spirals into something else that never had to spiral. So, okay, so just to summarize, if you're having painful sex, dryness, any discomfort at all when it comes to sex, understand that it's a real thing, and that you need to consult with either your OBGYN and or a pelvic floor specialist therapist. That's what
Absolutely.
Okay. All right. Well, thank you again, Brooke, for having this really important conversation around pelvic floor issues. We first talked about, our first episode together was all about the pelvic floor and what a therapist does. Now we have painful sex. Incontinence is next on our list later. But if you are watching this and you would like to connect with me, because I would love to connect with you, please head over to jodisilverman.com. If you have a topic that you would like to hear discussed on the show, or maybe you want to be the one discussing the topic with me in a future episode, again, head over to jodisilverman.com, contact me through my website. You can find back episodes there, and let's chat about what you have to say. And I look forward to more conversations with Brooke. And as I always say, everybody, dare on.